Hey guys, this morning I want to talk to you about patient advocacy, if I can say that. If you don't know what that is your rights as a patient. And I want to tell you a quick story, if I can, about something that happened with me and how I advocated for myself. And if I have not worked at a doctor's office for a long time, I would not have known what that is. And I know that that's just your patient rights, for you to stand up for yourself, to advocate for better health care, and to advocate for better health when you're in a doctor's office or a hospital. I had cancer 4 years ago, thyroid cancer to be exact. And during that time, before that, I had all kind of symptoms that were going on. I was not sure what was going on with me, but I knew that it was not right. Whatever was going on with my body I didn't feel right. So I went to a doctor and they were like, you can't go by just feeling, so let's do blood work. Well, we did blood work and they checked everything and I came back normal. And it was, come to find out, I went to another doctor. And that other doctor told me the same thing. So I went to 4 doctors. One of my doctors had told me, and this was at a national facility, major. And I was told I was just fat. I was about to turn 40, and to face it, it was not going to get any better. To get off my butt and start working out. That was not the problem. Working out was not the problem. I knew how to work out. I knew what to do. I knew to work. I was in healthcare for 15 years. I was a nutritionist. So there was just things that happened along the way that got me to the point where I was frustrated, scared, and felt like nobody was listening. I went to one doctor and he did listen to me. It was a doctor I used to work for, and he said, I told him to humor me and do a thyroid globulin, which is a thyroid test for cancer markers. And then I asked them to also do a ultrasound. He was like, can I ask why? I said, I've had all kind of issues and I just want to be checked out. And it's about to cut off, so I am going to have to do a part 2. So I'll be right back.